An athletic therapist's scope of practice is the assessment, prevention, immediate care, and reconditioning of musculoskeletal injuries. This presentation will illustrate the many disciplines encountered by an athletic therapist, from the classroom to the field to the clinic.
Hi, I'm Frances Flint. I'm a faculty member at York University, and I have a PhD in sports medicine and sports psychology, but more importantly, I'm an athletic therapist, certified to the Canadian Athletic Therapist Association. And I teach here at York University and teach students who want to become certified athletic therapists in what I think to be a dynamic profession. We have two aspects to our profession. One is in the clinic, where we assess and treat injured athletes, and the other one is in field settings, where we hopefully prevent injuries, but more importantly also where we try to help athletes once they have been injured. And in that context then, we work in the clinical setting to help those injured athletes get back on the field. So if you want a dynamic profession, working with injured athletes who are amateurs, injured athletes who are professionals, and just the ordinary daily Canadian who is active, then certainly you should choose athletic therapy.
It's exhilarating. You get to help people. If you're involved in sports, it's phenomenal.
I'm at University of Guelph, covering the Ontario Provincial Senior Level Wrestling Championships. One of our jobs is to cover the medical component of the wrestling, as well as deal with some of the wrestling in the rehab and the first response and that kind of things. What we do to set up some of the stuff here, in this wrestling tournament, is set up an emergency action plan to deal with any of the emergency situations that may happen in wrestling, as well as setting up enough therapists to cover enough mats and make sure the athletes are in well care. So the assistants that we bring in, I usually kind of handpick who I want to make sure that they're comfortable in covering wrestling. Wrestling is considered a high-risk sport, and we want to make sure that I have enough care for the wrestlers, and so therefore the assistants that I bring in definitely know what's going on with the sport itself and the risks associated with the sport. I got involved with wrestling 6 years ago. I started as a student and basically took a tournament, and from there just progressed up the chains, I guess, into the national level, and now I'm working with the national team with wrestling as well now. It's something that us as an AT, I think we love the field. I love the field anyway, as much as clinical, so it's a nice adjunct between field and clinic, and to be with these athletes at the high end, it's one of the things I think we as athletic therapists love to do. It's a great career choice. I mean, I've enjoyed the last 5 years I've been certified for. I think people have to make the most of it. If they're going to do well in this profession, they got to work for it. This position didn't come in very easy for me, but it took me 6 years to get where I was, and I'm definitely loving every moment of it.
It's a wonderful feeling once you help an athlete, especially once they've actually acquired the goal that they want, and you know that you're part of it through any accredited program at a university in Canada.
Currently, there are 7 accredited institutions in Canada where you can become a certified athletic therapist. These include Concordia University in Montreal, Mount Royal College in Calgary, Kemison College in Victoria, BC, Sheridan College in Brampton, York University in North York, and in Winnipeg, the University of Manitoba and the University of Winnipeg.
My name is Heather, and I'm currently enrolled in the athletic therapy program at Sheridan College in Brampton. I think it was working with the Laurier football team. I worked with them from 2005 to 2008, and I think there was just a few connections I made with some of those athletes that I was part of their whole rehabilitation process, and some things that I did really helped them in their path to recovery and return to sport, which really made a difference to me and helped me feel like I was actually doing something to help get them better. So that really instilled something in me and made me want to continue within this field and be able to provide that for so many other athletes. So I'm currently working at a ringette tournament right now and learning a little bit more about that sport. So as you progress, you learn a lot about different sports and the rules that go into them and the types of equipment that you're going to be working with. And yeah, it's just a really good experience to get all that.
Hi, my name is Mike Grubstra. I have a BSc in kinesiology from the University of Waterloo. Today we're just doing a little bit of field coverage here at Rim Park in Waterloo, just covering a little bit of field hockey. What purpose we serve here is we do emergency medical coverage. We evaluate a situation to determine if an athlete needs further medical assistance, and so we're kind of set in making those decisions. Where I want to go further with this, the opportunities are clinical work, more field work in a professional environment, or doing weekend coverage in minor situations like this. So that's kind of the things you can look forward to with an athletic therapy degree.
a great program to be into. I recommend it for anybody who wants to be in it.
My name is Matthew O'Brien. I'm playing for the Hamilton Bulldogs. Darren, our athletic trainer, and he's on the ice with us every day and in the gym after. And he's getting us ready for the game. He knows what he's doing, and we trust him, so we like to work with him.
Darren McConaughey, I'm the head strength and conditioning coordinator with the Hamilton Bulldogs. I went to York University. I did my degree in kinesiology, and I did athletic therapy concurrently with that. Upon graduating, I started a conditioning business, and through that, I was able to get hired by the Montreal Canadiens and start working with their AHL affiliate here in Hamilton. The spin I took on it was a conditioning spin. I went through the NSCA, the National Strength and Conditioning Association, and got my CSCS, which is your Certified Conditioning Specialist degree. And so I work more from a conditioning perspective in Hamilton, but Hamilton really appreciates my position as an athletic therapist because I can dual purpose with Luke, who is here, in rehabbing injuries from an exercise standpoint. I can go on the ice and skate players. So I've taken the therapy approach from more of a conditioning background. No, I think it works really well having a conditioning coach as an athletic therapist. We're able to communicate very well with the head athletic therapist here in Hamilton. You're on the same page when you talk to an AT, rather than just being a conditioning coach and coming purely from a conditioning philosophy or background. So it really melts well together.
My name's Luc LeBlanc. I'm the athletic therapist for the Hamilton Bulldogs. Well, it's when you become an athletic therapist, your goal is to try to go to the highest level possible, just like the players. And the Hamilton Bulldogs is the farm team of the Montreal Canadiens. So we get to work with the future players and the prospects of the Montreal Canadiens. My job takes me all over North America. We have games in San Antonio, Houston, and sometimes we'll go to Manitoba, or we did training camp this year in St. John's, Newfoundland. So we're all over North America, and half our games are actually at home and half on the road, so we're all over the place. The first responder part is nice, but the most rewarding part is the treatment and the rehabilitation of major injuries and getting them back to playing 100% the quickest possible. You have to help people become better. Some of us do a lot of prevention. The training that players put in, we help them follow their nutrition programs, hydrate themselves properly, train properly, and then the rehab of injuries is just part of your job. This is my sixth year in Hamilton. Every year I've had an athletic therapy certification candidate. They're very mature, and they're taught all the skills, and they get a chance to use their skills here and to observe what we do.
I love it. It's definitely not a desk job.
Professional sport would definitely be a big goal for me, and eventually I'll probably end up opening my own clinic to have my own clients come and see me and work on the rehabilitation that way.
It's one of the most rewarding careers I think you can have.
Anybody that likes sport and that wants to help people, I would definitely recommend athletic therapy.
Totally. I mean, as an athlete that comes up to and thanks you for their help is probably the most gratifying thing you can do, that you get them the extra race that they wouldn't have gotten without your help. That's probably the only honor in what you do, because our work, I think, is a silence work. And you don't get the thank yous, you don't expect the thank yous, but it's nice to hear a thank you from an athlete that you really made the difference for them today.
Many varied and exciting career opportunities exist for graduates of the Canadian Athletic Therapy programs. These include professional sports, amateur sport, clinical practice, sports medicine product marketing, insurance claim specialists, strength and conditioning, military placements, research, and education. To explore the exciting possibilities of athletic therapy, please visit www.athletictherapy.org.